Assessing male genitourinary system. Good day, ma'am. I'm going to perform male genitourinary system. The definition is the male genitourinary system are the organs of the reproductive system and the urinary system. The purpose of this is to detect if there's any abnormalities that may range from life-threatening diseases. The first action is introduce self and verify the client's identity, explain the procedure to the client, and provide privacy. This is to gain cooperation and lessen the anxiety of the client. Ask the client to empty her bladder before the examination begins. This is to provide clients comfort. The third action is perform hand hygiene, apply gloves, and observe appropriate infection control. This is to minimize contamination. The fifth action is do perineal care. This is to prevent the spread of microorganisms. Next is inspect the distribution, amount, and characteristics of pubic hair. Next is inspect the penile shaft and glans penis and note the skin condition, presence or absence of foreskin, position of the urethral meatus, and any lesions, swelling, inflammation, or discharges. Okay, for the scrotum, inspect the scrotum for skin condition, size, position, and symmetry. Inspect all skin surfaces by spreading the irrigated surface skin and lifting the scrotum as needed to observe posterior surfaces. And for the inguinal area, inspect both inguinal areas for bulges while the client is standing. If possible, have the client remain at rest. Next, have the client hold his breath and strain or bear down as though having a bowel movement. Bearing down may make the hernia more visible. The next action is remove and discard gloves. Perform hand hygiene. The last action is document findings in the client record using printed or electronic forms or checklists, supplemented by narrative notes when appropriate.